Welcome to our series of learning modules that focuses on the value of research in patient care. Our objective is to educate clinical staff on the scientific method and how to apply it to everyday clinical practice. In this, the second section of Module 2, we will explore the development of specific, measurable outcomes for the clinical questions and hypotheses we covered in Section 1. Our first clinical question focused on the influence of two variables, sodium intake and physical activity, and how a decrease in one and an increase in the other could lead to changes in patient blood pressure. Now we'll consider how to manipulate these variables to test our hypothesis. The first thing we could do is assign some patients to a lower sodium group and other patients to a clinically standard sodium group. We could then decrease the lower sodium group's intake by 20% versus standard intake. The next thing we could do is increase the amount of daily exercise that lower sodium patients get over the course of several weeks. Our primary quantitative outcomes for both groups would be average daily blood pressure and ending blood pressure compared to beginning blood pressure, as well as weekly and monthly trends. Our secondary quantitative outcomes could be patients' physical stamina and even patients' ability to more flexibly move their limbs. Our second clinical question focused on whether varying exercise types for patients could lead to short and long-term changes in pulmonary function. Let's consider again how to manipulate specific variables to test our hypothesis. The first thing we could do is assign some patients to a challenging exercise group and other patients to a static exercise group. We could then progressively increase the duration and difficulty of physical activity for the challenging exercise group on a weekly basis. The next thing we could do is increase the number of new exercises that the challenging exercise group completes every month. Our primary quantitative outcome for both groups would be average weekly and monthly FEV1 values, which would provide a measure of overall lung capacity. Our second quantitative outcome could be average weekly and monthly SpO2 values, which would help us gauge blood oxygenation levels. Our third clinical question focused on caregivers' experiences and collaborations when treating patients with lymphoma. In applying a qualitative approach, we want to understand the interactions between family caregivers and healthcare professionals who work with patients living with lymphoma. This could involve support systems, interpersonal communication, and/or psychosocial dynamics. The next thing we could do is think about techniques to elicit information from our sample, which may include structured interviews, focus groups, and/or direct observation. These techniques, used alone or in combination, may provide rich and nuanced insights into the lived experiences of family caregivers. In Module 3, we will discuss options for study design and analysis. We've explored how to generate focused clinical questions and hypotheses, as well as specific measurable outcomes. We conclude by discussing implications of these concepts as they relate to the Stanford EBP model. The first step of the EBP model is I question what I'm doing. When we focus our clinical question, this paves the way for a clear and concise hypothesis or testable idea. Next is I systematically investigate. With a focused question and clear hypothesis, we're able to maximize the efficiency of our literature search and data collection. Step 3 is I measure an outcome. Once we understand the variables related to our question, we can consider a range of outcome measures, both quantitative and qualitative. Next is I make a decision. After analyzing specific measurable outcomes, we'll be able to more precisely interpret results and weigh the clinical implications of those results. Finally, I disseminate. In sharing recommendations based on a tested idea, we pass along to our colleagues the strongest possible empirical evidence. Now we'll ask you to reflect on what you've learned. Based on what we've discussed, what is an example of quantitative data? One example of quantitative data are the number of days until a patient is readmitted. Based on what we have discussed, what is an example of qualitative data? One example of qualitative data are patients' interview responses on their interactions with physicians. True or false? A testable idea can be confirmed or disconfirmed with data. The answer is true. You can use data to confirm or disconfirm your hypothesis or testable idea. This education series is made possible by a generous gift from the Stanford University School of Nursing alumni, in collaboration with Stanford Healthcare, Lucile Packard Children's Hospital, and Stanford Medicine. Congratulations! You have completed Module 2.